Poso maoni wiak, waiwanan kitana ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnameneha kihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. We are your hosts, Gary Dodge and
Sheena Wapus. On this episode, we are joined by guest Vaughn Bowles, the Public Information Officer, the Public Information Officer for the Menominee Indian Tribe of Wisconsin. I would like to remind people, we request that you send in your COVID-19 related questions or topic suggestions into us at podcast@mitw.org. Welcome, Vaughn.
Hey, thanks.
Happy Friday.
Happy Friday. Yay.
So we did actually get a question sent into us this last week regarding nebulizing hydrogen peroxide in a saline solution. Can you answer that question?
Yes, I'm going to say, don't do it, everyone. So hydrogen peroxide, let's talk about hydrogen peroxide really quick. Hydrogen peroxide is effective at killing bacteria and viruses because it contains what are known as free radicals. They're essentially electrons that can attach themselves to a lot of different types of materials. When it comes into contact with bacteria and virus, it binds to either their exterior membrane or their protective coatings, and it effectively destroys it. That said, you don't want to inhale anything like that because your lungs are very susceptible to damage. So I would highly, highly, highly recommend not inhaling anything through a nebulizer unless it's prescribed by your doctor. Same thing with a humidifier. Do not atomize things and inhale them unless you're supposed to. I mean, a humidifier and a nebulizer work in similar ways. They increase the moisture content for the air you're breathing in, which moistens your mucus. And yes, you can trap more bacteria and viruses and dust, anything that you might snort through your nose that way. But you don't want to inhale chemicals that haven't been specifically given to you for that purpose. Don't try it at home. Don't try it at home, people. Please.
Thank you.
Yeah.
will the closure extensions be on a week-to-week basis?
Yeah, so right now, the incident command's been evaluating the continued rise of COVID-19 in the reservation and in the surrounding counties. And we've decided that we're going to evaluate the closures on a week-to-week basis now so we can be responsive to it. We haven't seen a decrease in the number of new cases yet, so we are going to remain closed until, I believe, October 12th, so one more week at this point.
Okay, and then how will these closures affect the tribe?
So that's what we're trying to figure out right now. I know one of the things that, the tribe is very concerned about is the revenue that's going to be lost at the casino. In Incident Command this last week, we spent a lot of time talking about the small businesses in the local areas and how that's affecting families. And so we're trying to find perhaps new strategies that, rather than having like blanket closures, can be targeted approaches to protecting at-risk populations, the elderly, children, immunocompromised. And so we're working on those plans right now. And we don't know the full extent of how the closures are going to affect people. We know that a lot of individuals have reacted poorly to, blanket closures and quarantines, and there's been, increases in depression across the country. We're still trying to see if, that's the case here as well. But we're working on finding out those answers as quickly as we can so we can prevent any long-term damage or psychological stress that might be occurring right now in the community.
Okay, and then what are the schools doing for students with rapidly rising cases?
So both the tribal school and MISD, all three of its facilities, have gone to just remote learning right now. After speaking with the representatives from MITS, they're going to remain doing virtual only until the end of the first quarter. That'll be November 5th. They're also talking with Dr. Schlegel, who is our medical expert on the incident command team. And probably at that time, they are going to reevaluate whether they should move to a blended, in-class virtual combination, or just virtual or all in person. And so it just kind of depends on how the spread of COVID continues in our local area. But right now, they're just remaining closed. Same with the tribal school. They've decided to remain closed. They're also in close talks with the incident command team and some of the medical professionals we have working on it. And so we're trying to protect our kids and our teachers, the staff members of the school as much as possible. And so we're having as little in-person use of the facilities while we can.
Okay, and then so along with remote learning, I know that some families up here, it's kind of hard for them to have Wi-Fi. Is there Wi-Fi available around the community for the students?
Yeah, absolutely. So even though a lot of the tribal offices are closed to the public right now, they still offer open access to public Wi-Fi. The tribal website has a list of all those facilities. I believe there's about a dozen or so of different locations where people can go and access the Wi-Fi for free without using any sort of access code or password. And so they can go to the tribe's website to find that. We could also post that in the show notes if you guys would like.
So Vaughn, this week we have a event going on with the flu shot. Can you talk about that?
Yeah, so right now, the Menominee Tribal Clinic is putting on essentially a drive-through flu shot clinic. It's being held at the transit garages, kind of behind where the old Head Start building is. Anyone who is a member of the tribe, tribal descendant, or has been a patient of the Menominee Tribal Clinic is eligible to go. Additionally, any tribal employees or individuals who have received vaccinations from the clinic in the past and have information on record with the clinic are also eligible to go.
And can you talk a little bit about why it's important to get the flu shot this year, maybe more than other years?
Yeah, so a flu shot gives you what's usually called an attenuated or a dead strain of a virus. And what that does is it really ramps up your immune system and kind of preps it for if it comes into contact with a live or a viable version of that disease. What it does is it gives you the opportunity to build antibodies and T cells prior to infection. And so if you are infected, your immune system is able to fight that off a lot easier. You're able to mount a response a lot faster, so you don't experience symptoms nearly as long. It's not always 100%, but it does significantly decrease your likelihood of getting infected. That said, if you can get a flu shot, we recommend it this year because if your immune system is already prepped to fight off one infection, it leaves more energy for it to fight off, say, an additional infection. If you don't want to be able, or you don't want to have to fight off something like COVID and the flu at the same time, that would wear your body's immune system down a lot faster. And so if you can prevent yourself from getting infected with one of those diseases, you'll be able to overcome an additional infection a lot sooner. So we would recommend getting it this year to help prevent at least the flu, and hopefully help your body be able to fight off COVID faster if in the event you're exposed to it.
And I always hear people talking about they got the flu shot and they got sick. Is that a thing? Is that real?
Sort of. So,
okay.
When you do get a flu shot, like we said, you're getting parts of a virus, and so your immune system does kick in. So what does that feel like? It feels kind of like a fever. Some people are also sensitive to materials that are contained in vaccinations. What does that feel like? It feels like nausea. So, people might feel like they are, in air quotes, kind of sick, but they're not infected and they're not contagious. And that's the most important thing. And those symptoms usually don't last nearly as long as actually contracting the flu. So if you have the choice, it's better to get the flu shot, feel a little crummy for maybe a day or two, rather than to get the flu and be sick for a week.
Got you. Is there any parting thoughts you have for people going into the weekend?
I would just recommend that, people maintain caution when they're going out into public, use masks and physical distancing, try to avoid large crowds. Remember to wash your hands for at least 20 seconds, soap and water. That's huge for maintaining personal health and hygiene, partly because just unconsciously we touch our faces so much. And if we have viruses or bacteria on our hands, it's going straight into our bodies when we're doing that. And so please remember to wash your hands, wash your kids' hands, wash everybody's hands. Everybody wash hands with soap and water. By that, if you don't have that available, use hand sanitizer with at least 70% alcohol and stuff to help remove any sort of viable viruses or bacteria that might be on your hands. Other than that, please stay healthy. Thanks for all the help in trying to keep COVID out of the community so far. We really appreciate it.
Thank you, Vaughn, for joining us.
Hey, thanks for having me back, guys.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab. Keep up to date by following us on Facebook at MITW Podcast. We do weekly updates with Vaughn. We welcome any community questions or topic suggestions you have regarding COVID-19, so please send those in to us via email at podcast@mitw.org.